Welcome to Quick Moral Quandaries. This is a follow-up to the medical ethics questions posed in the previous video. If you did not get a chance to take the exam and would like to do so at this time, please click the link on your screen and then return to this answer video when you're done. As in the previous video, I will play the question for 5 seconds to allow you enough time to pause the video and reread the question if you wish. Then I will reveal the answer and discuss why it is correct. However, before we examine the answers, I would like to take a moment to reflect on the implications of medical ethics in relation to theistic morality. I find medical ethics to be so fascinating because we are required to implement our moral reasoning in order to discover the best course of action in a difficult situation. Physicians are bound to the Hippocratic oath, dating back to the 5th century BCE. The original oath was sworn to the Greek gods, including Apollo, and the oath served to guide the practices of healers and bind them to the doctrine of do no harm. Ethics was of immense importance to the Hellenistic world. In fact, Plato and Aristotle were the first great philosophers to study and write about ethics in detail. In contrast, Jews, Christians, and Muslims believe that morals and ethics are only derived from their specific holy books. Therefore, how do monotheists explain the refined set of medical ethics we have today? What does the Bible have to say about the therapeutic privilege exception to informed consent, doctor-patient confidentiality, sexual relations with former patients, and accepting gifts from pharmaceutical companies? Ancient scrolls written many thousands of years ago could never hope to predict all the moral and ethical dilemmas future societies would face. The Bible cannot speak to modern-day medical ethics, just as it has nothing to say about insider trading, sexual harassment in the workplace, or the ethical obligation of lawyers to defend clients known to be guilty. I find it truly amazing that at the same time the Greeks were refining a code of ethics by which to conduct the practice of medicine, the Hebrews were cursing Babylon and threatening to seize Babylonian infants and violently dash them against rocks. These two groups actually coexisted, and you cannot hope to find a better example of two morally polarized theistic belief systems in the ancient world. There is a major disconnect between what the Bible considers to be moral and the ethical standards of practice of physicians, lawyers, law enforcement officials, and the public at large. Our modern understanding of ethics can only be derived from moral reasoning. The Bible simply did not have the foresight nor the capacity to speak on modern-day ethical dilemmas. And in some cases, such as those of slavery and infanticide, the Bible is totally devoid of ethics, compassion, and the doctrine of do no harm. Now, let's discuss the answers to the medical ethics exam. Minors can consent to treatment for pregnancy, sexually transmitted diseases, birth control, and drug or alcohol addiction without parental consent or notification. No matter how serious or trivial a medical error, a physician is ethically obligated to inform the patient that a mistake has been made. Ethics committees and risk assessment personnel can assist if a patient wishes to speak to someone or threatens a lawsuit. It is unethical to discuss any information regarding the patient's diagnosis, treatment, prognosis, etc. with a physician who is not directly involved in the patient's care. Likewise, a physician should never confirm nor deny whether a person of interest is in fact a patient. A physician must always contact Child Protection Services immediately if child abuse is suspected. The proper authorities must also be contacted in cases of elderly and spousal abuse. In situations where you need to relay difficult information to a patient, you should take the approach of immediately informing the patient of the news, giving them a moment to think, and then subsequently explaining what the news means and what are their options. You should always end the conversation by answering any questions the patient may have. The patient has the right to informed consent, and all information relating to the patient's healthcare must be fully disclosed, unless the patient has expressly asked not to be informed. The patient also has the right to refuse any treatment, even if failure to treat the condition could lead to the patient's death. A parent has the authority to make all healthcare decisions for his or her child unless that child is emancipated. If a parent's decision is not in the best interest of the child or the child is placed in imminent danger, then the medical practitioners should seek a court order. However, emergency life-saving therapy should be administered to all minor children, regardless of their parents' wishes or religious beliefs. Ethical principles, as well as the Health Insurance Portability and Accountability Act of 1996, dictates that patient information cannot be disclosed to others, including loved ones and family members, without the patient's explicit consent. Documentation that the patient has granted consent for disclosure of their health information should be placed in the patient's chart. When an ill patient requests your prayers in a distressful setting, it is appropriate to offer your support without interjecting your personal beliefs. The overriding goal in these situations is to do no harm. This cannot be achieved by disagreeing with the patient, entering into a religious debate, or displacing responsibility for the patient's care onto others. When treating patients that are referred to your specialty care for second opinions, it is imperative to not undermine the patient's relationship with his or her primary care provider. Avoid negative comments about the quality of care rendered by the practitioner. When interacting with difficult patients, it is best to try to calm them. Explain your position and inquire more about what troubles them by using open-ended questions. In situations where patients are unable to make decisions for themselves, responsibility for those decisions falls to the next of kin if the patient does not have a written directive clearly stating their intentions. The next of kin for a married person is their spouse, followed by their adult children. The next of kin is able to make decisions based on how they believe the patient would have wanted things. Just as competent patients have the right to refuse medical care, they also have the right to refuse knowledge of their own medical information and diagnoses. In cases such as these, it is essential to ensure the patient is well informed of their rights before they make their decision, and also find out from the patient who their surrogate decision maker should be. The responsibility of a physician who serves in a medical capacity at a sporting event is to protect the health and safety of the players. The desires of the spectators, coaches, or patient should not affect the physician's decision. The physician's judgment should be only guided by medical considerations. There are 4 situations where disclosure of the patient's information without their consent is allowable. 1. When child, elderly, or spousal abuse is suspected. 2. When a patient has sustained gunshot or stabbing injuries. 3. When a patient is diagnosed with a reportable communicable disease such as AIDS. 4. When a patient threatens to kill or physically harm someone else during their interaction with the physician and has a reasonable ability to carry out this threat in the future. In many states, it is a crime to intentionally infect someone with the AIDS virus without their prior knowledge. A person donating HIV-infected organs, tissues, and blood can be prosecuted for transmission of the virus as well. You must immediately prevent any physician you suspect of taking drugs or alcohol from treating patients while on call. It is highly unethical to allow this doctor to continue practicing medicine while intoxicated, and he must be reported to hospital administration. As a rule, physicians should maintain a general policy of not accepting gifts from patients or their families, especially if gifts are of great value or if preferential treatment is expected. Exceptions to this rule would be in cases of gifts with token value, such as cookies. Physicians are also barred from accepting expensive gifts or kickbacks from pharmaceutical companies, thus preventing the possibility of favorably prescribing the company's drugs. Although it is generally frowned upon for physicians to date their former patients, if a sexual relationship does begin, the doctor-patient relationship must first formally end. However, due to the nature of psychiatrist-patient-doctor relationships, these physicians are never permitted to engage in relationships with their former patients. Psychiatrists hold too much influence over their patients, and to engage in a sexual relationship with anyone they have formerly treated, no matter how long ago the treatment was received, is an abuse of power. Patients that are in their final days, with no hope of recovering from their illness, are not at risk for addiction to opioids or other pain medication. Although euthanasia is not legal within the United States, in the described scenario, it is permitted for a doctor to administer higher than normal doses of pain medication to both alleviate suffering and hasten the patient's death. I hope you did well on the exam, and perhaps even learned something new. As we can see by the sheer variety of ethical dilemmas that doctors and other healthcare providers must face, there is no conceivable way the authors of the Bible, Aristotle, Hippocrates, or any other ancient text could have predicted the way ethical conduct would be practiced by future civilizations. Indeed, the body of medicine is continually growing and shows no signs of relenting. In 100, 500, or even 1,000 years, the novel problems the future of medicine will encounter will be entirely different than our own. There is no conceivable way to predict the kinds of bioethical dilemmas our descendants will face, and only a strong ethical foundation and the ability to morally reason will allow them to continue to refine their ethical codes of conduct. However, what we can be certain of is that the foundations of ethics will never change. Do no harm was the underwriting principle of medical ethics over 25 centuries ago, and it will continue to be 25 centuries from now. But unfortunately for monotheists, the same kind of comparison cannot be made with their historical documents regarding moral and ethical conduct.